Welcome to the Super Healthy Human Podcast with your host, Dr. Roger Murphy.
On today's Super Healthy Human Podcast, I want to welcome my friend and colleague, Anna Topiler. Anna is a board-certified nutritional specialist and functional medicine practitioner. She's the owner of Complete Nutrition and Wellness. She's been in private practice for over 20 years, and like myself, she practices telemedicine and works with clients all over the world. On today's podcast, we're going to do a deep dive into the importance of optimizing your thyroid function. Your thyroid controls every cell in your body, and when it's not functioning correctly, it can create all sorts of health problems. So today we're going to dive deep and we're going to share with you what your thyroid is supposed to be doing, and if it's not doing what it's supposed to be doing, how to fix it. So welcome, and let's get started. Anna, welcome to the podcast. I'm so glad to have you here. Looking forward to sharing some information about hypothyroidism and Hashimoto's. I think that's easy for people to get a little bit overwhelmed about the role that your thyroid plays in health. And I know I'm guilty sometimes of being a little bit nerdy about it, talking maybe over some people's heads. But you, as a thyroid expert, I know you'll be able to clear some of this up. So, the first thing, first of all, welcome. And then second of all, can you tell us, what is hyperthyroidism? What is hypothyroidism? What is Hashimoto's disease? Let's just start there with the basics and go from there.
Absolutely. Well, thank you so much for having me. It's wonderful to connect with you here. And, when it comes to thyroid, I know it's complex, and I know people often think, oh my gosh, it's so confusing. What do I do? But it's really not that much of a mystery if you know some of these terms, because everything does kind of fit together. So for the basics, hypothyroidism is a slow thyroid or an underactive thyroid. And so those are the people that tend to feel tired a lot, maybe gaining weight, may have certain issues with their hair or their skin being dry, right? So these are all things that the thyroid is responsible for. And when it's slow, you don't have enough thyroid hormone. When the thyroid is hyper, that would mean the thyroid is overactive, meaning that it's producing too much hormone. And so oftentimes with that, people may feel things like heart palpitations. They may feel like, they're not sleeping as well, or they have this excess energy, but not like a good excess energy, but almost like this wired kind of energy. They may feel their skin is more oily, their hair may be more oily, and things like that. Hashimoto's is another very important term. So Hashimoto's is the autoimmune disease that affects the thyroid. And what's really important to know here is that in Hashimoto's, the immune system is attacking the thyroid. Now, of course, unfortunately, the thyroid is the innocent bystander, right? And when it gets attacked, it gets destroyed over time. But it's not the thyroid's fault. And this is where people sometimes can get confused, because they think, oh, I have Hashimoto's, I need to go get on thyroid medicine. And in some situations that may be true, and they may in fact need medicine. But the important thing to remember is it's not the thyroid's fault. So yes, we want to support the thyroid, but even more importantly, we want to support the immune system, because it's the immune system that got confused and started attacking the thyroid.
So hypo meaning slow down thyroid. So your thyroid function is slowed down. And since the thyroid is one of the master glands, kind of controls every cell, every function in the body, once it slows down, many, if not all, the systems in the body slow down. So you already mentioned some of the symptoms like lethargy, fatigue, losing your hair. A lot of people who have hypothyroidism lose the lateral third of their eyebrows, or their hair thinning out, constipation, high cholesterol, anxiety, depression, brain fog. These are all symptoms of low thyroid. And then you mentioned that hyper or accelerated thyroid function, it would be someone who felt revved up. So it could increase your blood pressure, elevated heart rate, and some of these things make you feel anxious, cause you to have problems in your sleep. So these are some of the differences between those two. And then you mentioned Hashimoto's, which is, as you said, an autoimmune disease where the body is erroneously attacking the thyroid tissue. Who is most likely to get low hypothyroidism, which is mostly what I treat? 70% of the people I work with have it. Who is most likely to get hypothyroidism?
So it is typically women, though of course men can have hypothyroidism, but the major cause of hypothyroidism is actually Hashimoto's. And many people don't realize that. So when you have an autoimmune and the Hashimoto's is destroying the thyroid, right? Your immune system is destroying the thyroid. When the thyroid gets destroyed, it obviously doesn't work as well. So it becomes hypo. So it is estimated that over 80% of people who have hypo or slow thyroid, they actually have Hashimoto. Some may know it, some may not, because it's not always tested. Now, of course, there are other causes of hypothyroidism. If it's not Hashimoto's, for example, there could be a toxic exposure. Sometimes an underlying virus can cause that. Sometimes if someone has a very large nodule, that can also affect the functioning of the thyroid and cause it to become slow. But Hashimoto's is really the biggest thing. And autoimmune disease is something that tends to be more common in women. And I think that's because women tend to have more hormone fluctuations, right? Because with men, the hormones are sort of like this, and then eventually they go down. With women, it's up, down, up, down, up, down every month, and then they drop. And so because of a lot of those fluctuations, I think is a big part of why women are more prone to autoimmune diseases.
So how is it diagnosed? Blood work, right? So typically someone goes to their doctor, maybe they're complaining of low energy or mental clarity issues or feeling depressed. And the doctor, let's say a conventional doctor, is running the blood work, and they will check the thyroid stimulating hormone, TSH, maybe the free T4. And then based on those results, that they make the diagnosis. Is that right?
That is correct. The problem is that most conventional doctors are not going to test all of the thyroid markers. So for Hashimoto's specifically, there are two antibodies. One is called thyroperoxidase antibody, and one is called thyroglobulin antibody. If you have either one of those antibodies, that means there is an attack on the thyroid and you have Hashimoto's. And those are rarely checked unless the doctor is specifically looking for it, or the patient may say, I have a history of it, someone in my family has it, or I've been diagnosed with it before. And so they check. But other than that, it's not checked, which is why so many people don't know. But for thyroid itself, you do test the TSH, which is thyroid stimulating hormone. And conventionally, if TSH is elevated too high, that actually means that the thyroid is slow or hypo. And then vice versa, if the TSH is too low, that means the thyroid is hyper or too fast. But as with most things, when we talk about conventional versus functional medicine, there is a little bit more to that story. And so, sorry, go ahead.
I was just going to say, I'm sorry. Let me say that's really that confuses people. It really does. I know for when I'm working with my patients or have people ask me about thyroid, when I tell them, well, we're looking at your TSH, and oftentimes their doctor will say, oh, well, it's a little bit elevated. And they'll say, oh, they get confused by that. They think that if their TSH is high, that they're okay. The higher, the better. When actually it's the other way around. Really, you really, if your TSH goes up, it's a sign that you need more thyroid hormones. And if it goes way down, it's a sign you've got too much, right?
Correct. Yes. So it's inversely proportional. And the reason for that is that when TSH goes up, it signals, that's the pituitary gland basically signaling the thyroid to produce more hormones. So a high TSH means there's not enough hormones, and it's saying, hey, thyroid, come on, let's go. You need to give me some more hormones. And so that's why it's actually very important to look at some of the other hormones. TSH is definitely the kind of number one test that most doctors will do. But TSH is just like one little portion. It's almost like looking at a puzzle, but we're only seeing this one little piece of it. So we can't make out the full picture if we only see the corner of the puzzle.
Yeah. So ideally, when I'm running these labs, I'm going to see what the free and total T3 and T4 is. So those are the thyroid hormones, TSH. And then I want to see what are the thyroid antibodies, which you mentioned earlier, TPO and TGB. I want to see if those are elevated. And then oftentimes want to see if there's an elevated reverse T3. So tell me, and I'm sure these are the same tests that you would recommend, but why is it that conventional medical doctors normally just check TSH, and then if they're real radical, maybe they'll do a free T4, and that's kind of it. As you said, it's only one little piece of the puzzle. They're missing the opportunity to put the whole puzzle together by just doing a little snapshot of what's going on with the thyroid.
Yes. And, I think because when you look at conventional texts, right, and a lot of this is from quite a long while ago, the definition of hypothyroidism is an elevated TSH. And TSH has a range. Most markers, right, have ranges that are lab ranges. And typically it's about 0.5 to 4.5. It actually used to be 0.5 to 5. They've lowered it a little bit to 4.5. However, there's quite a bit of data and research showing that 4.5 is a little bit too high. So even though the lab is saying 4.5 is the upper limit, a lot of people, and this isn't just in functional medicine, but this is, even conventionally, there's been articles in journals saying that a TSH that's above 3 could possibly mean that something is going on, perhaps not something where it's already it really hypo, but maybe the start of something. And so I think that's kind of the number one issue where sometimes things can go awry. But, to answer your question, because the definition of hypothyroidism is high TSH, doctors think, well, let me test the TSH. If it's not high, then we have no issue, right? That no problem. But I think that what's important to understand here is what happens once the TSH is produced, right? Because that thinking is, if TSH is okay, then everything is okay. That is kind of a little bit of like a tunnel vision thinking, because it's just saying that TSH is the only thing and there's nothing else there. So let me explain a little bit about what actually happens with thyroid hormone production. And I promise, very layman terms, this is going to be easy to understand. So once the TSH is produced, which, by the way, a lot of people think that's a thyroid hormone, it's actually a pituitary hormone. Your pituitary produces TSH. And once TSH is produced, that stimulates the thyroid to produce two hormones, T4 and T3. So those are the main hormones the thyroid produces. The thyroid actually produces mostly T4, about 94% or so of T4, and only about 6 or 7% of T3. But what's interesting is T3 is the active hormone. So people say, well, wait a minute, why would the thyroid produce so much T4, which is not as active, and so little T3? Well, the reason is we need thyroid hormone for everything, literally from our head to our toes. And so if you were to produce the T3 right in the thyroid right here, it would be taken up by the cells here, and there wouldn't be enough to go around the body. So our body's super smart. It produces T4. That T4 then travels to two areas. Well, it travels to many areas, but specifically the liver and the gut, which is where it converts that T4 to T3. And there are enzymes that are needed to do this. There's certain other factors that are needed, but those are the areas where it converts. And then there's a little bit of it that also converts to reverse T3, which you mentioned earlier. And reverse T3 is sort of like, I explain to people as like an overflow valve. It's just making sure that you don't have too much T3 because it is active. So there's always that little bit of opposition. But in some situations, due to many issues, whether that's stress or inflammation, sometimes people can produce too much reverse and then they may not have enough T3. And so then once people convert into T3, that then goes into the cells. And so the problem is, if you look at TSH and TSH may be okay, you may be producing enough T4 because that's what TSH is stimulating, but you may not be converting to T3. We can't see how you convert by your TSH. There's no way to tell, right? So unless you're testing T3, how would you know that you had enough? You wouldn't. And that's where a lot of people may have issues.
Great explanation. So that's wonderful. Anybody I think can understand that. And I think what's important to keep in mind, I always say this, is when we're doing that test, when we're doing a blood test, especially if we're just doing a basic TSH, we're looking at how much thyroid, actually we're looking at how much TSH is in the bloodstream 1 second out of 1 minute out of 1 hour out of the day. So we're looking at just a tiny little snapshot. And the problem with that, as you just shared with us, is that TSH really doesn't, you can't tell how much T3 is in the cell. So if you see the TSH and the number looks okay, it's almost like a guesstimation that, okay, well, if your TSH is within the parameters of normal, then you're fine. And we know that's not true because there's a lot of people that have a normal TSH and yet have all the symptoms of low thyroid, right?
Exactly. Well, and I think, like we were saying, what's normal TSH, right? To some doctor, if they see a lab result of 4.39, they're like, well, it's less than 4.5. You're normal, right? Versus a lot of people say normal is really under 3. So it just really depends how you look at it. And, another thing with this, when you were talking about how TSH does fluctuate, because you're seeing it in that second that you're testing it, other hormones fluctuate too, especially the free hormones. So a lot of times, in addition to TSH, doctors will run a free T4. They still don't even look at T3, but they will do T4. And that's okay, it's helpful. But the free hormones only account for literally like 1% of all of your thyroid hormones. So you also can't base everything on 1% of your total.
Several years ago, the American College of Endocrinology, really the people who are experts in thyroid, came out and they said that anybody with a TSH above 3.01 should be considered hypothyroid, should be placed on medication or should be treated. Somehow, that memo never made it around to the doctors in the field. So we still, here we are in 2021, and this was years ago.
This was 2012, I think.
Yeah, it's been years ago. I remember the first edition of my book back in 2005. I had it in, or 2000, maybe the second edition. I don't know. Anyway, this is something that's been known for quite some time. And yet the parameters in conventional medicine, as you mentioned, usually are somewhere like 0.5 to 4.5. Now, I'm a little older than you, and I can remember early in practice when I'd have patients that I would share with them, hey, I think you've got a problem with your thyroid. And they would not be, their TSH would be at 6 or 7. And the doctor would tell them, oh, no, we're just going to watch it. You're okay for now. Wow. So, it's come down. But in my practice, anybody with a TSH above 3.0, I recommend that they either get on prescription medication or they work with me naturally, some over-the-counter glandulars to treat that. So in functional medicine, we use different parameters. And for us, somewhere between 1 and 3 is normal. And anything outside of that is abnormal, no matter what the conventional marker is. And part of that is, in functional medicine, we're looking at making sure that the systems are working at optimal levels. Yeah. And so if you're at, if you're at 4.2 and the conventional parameters 4.5, they tell you that everything is normal. Well, you're almost abnormal, right? So we want you to be an A student or a B student. We don't want you to be a D student or an F student. We want you to be at optimal range, not at suboptimal, and just be an average person. So I think it's important that people realize that when they get their thyroid test results back, and I always encourage people, make sure you get your test results. If you see that your TSH is above 3.0, you really need to search out someone that can help you get on the right protocols to fix your thyroid problem.
Absolutely. And, with that, you also want to make sure that you're looking at your other hormones. A TSH above 3 certainly isn't good, but there are some situations where, maybe the thyroid hormones are good. That doesn't mean you don't need thyroid medicine, right? But it could mean something else, right? Because there's all of these different types, as I call them, right? So you could be someone with a high TSH and possibly low hormones. That would be more of a classic hypothyroid type, right? Versus you may have a higher TSH, but normal hormones. That could be part of an inflammation that could be from Hashimoto's or from some type of a toxin, right? So it's so important, like you mentioned, to look at all of those markers. Just like someone can also have a normal TSH and a normal T4, but a low T3. So they would be considered a low T3 type. They may have the exact same symptoms of someone with a TSH of 20, right? Totally different presentation, but it's still a slow thyroid state. It's just not as classic, right? Or there's some people who have low free hormones. So their TSH might be okay, their total T3 and total T3 might be totally fine, but you look at their frees and they're both low. And I know we mentioned earlier that frees only account for a small part. We can't just look at that. But when you look at them in relativity to the others, that also means something. They would be considered a low free type. And for them, that could be an underlying hormonal issue. There could be some other type of inflammation that's going on.
So, there's always, there's a whole tapestry of different things that are going on with the thyroid and looking at these different results. But oftentimes people have all the symptoms of low thyroid. They go to their doctor, they get the basic tests, and their doctor, it may even suspect that they have a problem with their thyroid. They got all the classic signs, weight gain and dry skin, some of the things we mentioned earlier. And yet the test will come back normal and the doctor's reluctant to even put them on a trial of thyroid medication. And I think that's a real disservice because, what I see oftentimes is because they're doing just the basic testing, they miss the fact that they got the beginning of Hashimoto's, and we'll talk about that, or they don't realize that they have a low T3, so it's, the T4 is not converting into T3, and they have all the symptoms. And instead of doing a trial, maybe, hey, let's put you on a low dose of thyroid medication, instead of doing that, they'll recommend, let's put you on, for low energy, let's put you on Adderall, or, for your depression, let's put you on Paxil, or, whatever it is. They'll treat the symptoms, these multiple symptoms, when really the whole problem is a low thyroid function.
Mm-hmm. Yeah, absolutely. I just posted something on my Instagram actually this week. It's, I have 101 problems, but like 85 of them can be solved by supporting the thyroid because the thyroid controls so much. And, what's also interesting, and this is, I think from a patient perspective, and especially someone who maybe is not new to functional medicine and may have seen other functional medicine doctors. And sometimes, and I don't know if you see this because I see this in my practice, people will say, yeah, my TSH is a little bit off. And yes, I have a little bit of this, but you know what? I'm very anti-medicine. And so I don't want that. I want to do it naturally and I'm going to heal my gut. I'm going to do all of this. And I, as a clinical nutritionist, obviously love to do things naturally, of course. But I think what's important to know too when it comes to thyroid is I personally don't look at thyroid medicine as kind of like a medicine. I mean, it is a medicine, obviously, but I look at it more as replacing an essential hormone that your body doesn't make. And I have personal experience with this. My thyroid was always a little hypo when I was younger, before I got into this work and before I really studied this. And I felt the same way. All medicine is bad. Everything natural is good. I'm not doing it. And, once I finally got on a small dose, it was night and day. And I was kicking myself, for years later about that. But I think that's what people also need to understand is that because thyroid controls everything, literally, I mean, obviously, we know your metabolism is a big part, your energy is a big part, but people may not realize your thyroid is responsible for keeping all of your membranes intact. So we talk about digestive issues, right? We talk about a big term is leaky gut that a lot of people are starting to learn about, right? It's big in the functional medicine space. Well, what's leaky gut? Well, that's an intestinal lining that isn't in integrity, right? And that could be caused by different microbes, and that can create food sensitivities. So people say, okay, well, I'm going to do all this. I'm going to take these vitamins. I'm going to cleanse. I'm going to heal my leaky gut. Okay, great. But do you know that you can't heal your leaky gut if you don't have enough thyroid hormone? So you're literally, it's like you're walking throughout your day in ski boots. Like you're making everything so much harder for yourself, right? Because if your thyroid really is hypo and you don't have enough hormone, you can take, glutamine until glutamine is coming out of your nose, right, to heal your gut. It's just not going to work the same. So, and I'm not saying everyone needs medicine. I'm just saying that, I think it's important to kind of understand there's certain times where even though it is a medication, it is needed and we don't have to look at it as a bad thing. This is different than, say cholesterol medication or other medicines where, there are a lot of other natural ways that can be supported.
Yeah, I think, just the nature of our work, I think we attract people that are looking for more natural options. And I think there is a misconception that thyroid, a prescription drug, is something that is, foreign and you shouldn't take it. But if you need to be on hormone replacement therapy, that's really what it is. It's a hormone that for whatever reason you're lacking. And of course, ideally, we want to figure out, what's causing you to have hypothyroidism? Is it an autoimmune disease, which is the number one reason? Or is it, too much stress? I mean, stress is the catalyst for most illnesses, including hypothyroidism. So, looking to figure out what's the underlying cause of that low thyroid. But absolutely, there's a time and a place. And if you've got an elevated TSH and you have all the symptoms of low thyroid, then getting on prescription medication is not a bad thing. For my patients, depending on how high the TSH is, I'll give them an option to do an over-the-counter glandular T3 supplement that seems to work really well for most people. But there's definitely a time and place for prescription medication. Now, having said that, what's your opinion of those going on synthetic T4 versus something like Armor or Westroid or Natrethroid? Let's talk about that a little bit.
Absolutely. I love talking about this. So, and just to make sure everyone's on the same page, we have the synthetic medications, which would be things like Synthroid, or the generic of that would be levothyroxine. There's also something called Tirosint, which is more of like a dye-free, excipient-free T4. And so that would be synthetic, as well as if people need T3, there's something called Cytomel, which is a synthetic T3. And with the more sort of quote unquote natural ones, those are things like Natrethroid, Westroid. They are desiccated. So they come from an animal source, and that's the thyroid gland of animals that is standardized to contain a specific amount of thyroid hormones. And the benefit of those is that they have both T4 and T3 all in one pill, but it is a very fixed percentage. It's 80% T4 and 20% T3. I think that from, if someone is kind of looking at it from the outside, especially when they're into sort of more natural medicine, they may think, well, why would I take a synthetic, right, when there's a more natural one there? I thought that at first too, but I think this is also a little bit tricky because, in my opinion, the synthetic medicines, I mean, yes, they're synthetic because they're synthesized in a lab, but they are pretty much identical to what your own thyroid is producing. So it's not the same as saying like synthetic estrogen replacement versus bioidentical estrogen replacement. It would be very different. So this is really very close, pretty much the same as to what your own thyroid is producing, versus the natural. It is actually, I think, more different because it comes from a bovine source, right? So it's thyroid glands from cows, and it's not the same as our thyroid, but there is sort of the natural aspect that it has the T4 and T3 in it. There's also the metabolites of T4 and T3, which is T2 and T1, that some people can maybe have benefits. So I think that it really depends on the person. Sometimes people say, I feel a lot better on the desiccated thyroid or the natural thyroid. And when we actually look and see, okay, well, why are you feeling better? Right? Is it because it's the natural, or is it because it has T3 in it? Let's say someone is taking Synthroid, which is T4 only, and they are someone who does not convert for whatever reason, because maybe they have Hashimoto's, or they have inflammation, or they have liver issues. So here they are taking a T4 medicine, Synthroid, and then they don't make enough T3, right? So they're low in T3. Then they switch to the natural, which comes in T4 and T3 combination, and they're feeling a ton better. And they're saying, oh, it's because it's not synthetic, it's natural. Maybe, but more probably it's because you weren't getting T3, now you are, right? So also there's different fillers and dyes and excipients in certain medications versus others. So it could be that as well. But another interesting thing, and this is something that it's not super common, but I do see it happen. It happened to me actually, is that if you have Hashimoto's, and when in Hashimoto's, we know that the immune system attacking your own thyroid. In some situations, sometimes when you take a desiccated thyroid, because it is more of like a natural source, sometimes the body sees that as your own thyroid and attacks that. So when I took Westroid, which is the desiccated thyroid, my thyroid antibodies skyrocketed, and they were in, say, like the 500 range. They went up to over 5,000. And I felt okay, right? I mean, my TSH was good, my T4, my T3 was good. And I remember this was a long, long time ago, and I was already doing this work on my own, but I was also working with a personal doctor too on it. And the doctor said to me, but you feel good, right? And I said, yeah. They're like, well, so who cares? And I was like, but that doesn't make sense to me. If my antibodies are skyrocketing, something is happening. My body's not liking this. So yes, I feel good, but there's something going on. And so I changed to a synthetic. And what I actually did is, because I didn't want to have a lot of the fillers and excipients, I opted to get my synthetic compounded. So I got the dosage of T4 I needed and the dosage of T3, and I calculate that based on how much I was getting in the desiccated thyroid. And I just basically took those numbers and figure out how much it would be with the synthetic. And I had a compounding pharmacy put that together for me, so there's no fillers or excipients. And my TSH stayed good. My T4, T3 were still good. My antibodies dropped within 2 months. They went back down under 1,000, and they were 5,000. And that was in 2 months' time. So it worked very quickly.
So it's a little bit of trial and error, right? I mean, because you don't know. I mean, just because it's synthetic doesn't mean it's not going to work for you. And then at the same time, you could be one of these people that it's on a synthetic medication like Synthroid or levothyroxine, and you keep going back to your doctor every 6 months getting blood work to tell you, oh, your TSH, everything looks good, but you feel terrible. You feel you've still got all the symptoms. And that's when you really need to make sure you're getting a reverse T3 done to see, is that synthetic T4 medication converting into T3? I mean, that's where you really want to see the full panel to see if this conversion is being made. And, what I find is, and the patients I work with who are under, like everyone I think these days, under a tremendous amount of stress, is that, again, stress is the catalyst for so many things, ill effects that we experience. And one of the things that happens, the more stress you get under, the more likely you are to release more reverse T3 to block that conversion. So it's definitely some trial and error. I think the important thing to point out is making sure you're getting a thorough test. So we mentioned that, and then making sure that you interpret the test yourself. I wouldn't rely on your doctor. I'd make sure you look at that to see what your TSH is, to see what your markers are, is very important. Now, we've mentioned Hashimoto's. We hadn't spent much time on it, but as we wrap up, let's talk a little bit about Hashimoto's. So first of all, we've talked about the tests that you want to get done, the TPO and the TGB. If those are elevated, that's a sign that you have Hashimoto's thyroiditis, or the beginning of that. Why is it that conventional doctors normally don't even test for that?
That's a great question. The reason is they don't know what to do about it.
Yes.
I mean, I hate to say it that way, but
Yeah.
yes. So conventionally, and this is what I was told 20 years ago, when I was first diagnosed, you have Hashimoto's, but guess what? Your thyroid function is fine. So we do nothing. We wait and we watch. Eventually the Hashimoto's will destroy your thyroid. When it does, then we'll put you on medicine. I mean, on what planet does that make sense? It didn't make sense to me,
Right.
So I think that, a lot of the things that we would do from a functional perspective is to look and see, okay, well, why is the immune system attacking the thyroid, right? What are the triggers? You mentioned stress. That's a big thing. Certain foods, if you have certain food sensitivities, that could be a trigger. Toxins, infections, different environmental pollutants. These are all things that can trigger the immune system to confuse the thyroid for something that's bad. And so functionally, we can actually work on calming the immune system. But conventionally, doctors say, well, if you have Hashimoto's, we just have to put you on medicine. And if your thyroid isn't bad enough, then we don't even put you on medicine yet. We just wait, right? So if they're not going to do anything about it, they're not taking a proactive approach. And, I think that's just not correct. And so, and I know you obviously agree with me on this too. And it's just so important to educate our clients and patients on that you actually can do something about it. And you can start even when your thyroid is not affected. A lot of people tell me, I have it, but my thyroid is not affected, so I can't do anything yet. And I'm like, no. You can, and you should, ideally.
Yeah. So in conventional medicine, it's all about waiting until your TSH is elevated. So your thyroid burns out, and now we know, your TSH goes up. So now you finally got hypothyroidism, and we can put you on a drug, hormone replacement therapy. Where in functional medicine, it's about what is the cause of this whole Hashimoto's? Why is the body attacking itself, attacking the thyroid tissue? And as you mentioned, there's several different things that can cause that. So in functional medicine, we're looking at really what is the cause, and we may use over the counter or prescription, depending on your your clinical background, your diploma or whatever. you might use prescription or over-the-counter supplements or glandulars, as well as looking at what's going on, compromising the immune system, causing it to be out of balance. But I think what's infuriating is that people, they develop the beginning of Hashimoto's. You see that in the blood test. They have elevated antibodies. They've got all the symptoms of low thyroid. And yet for years, they've gone to their conventional doctor who's never checked for that. And they keep telling them everything's fine. Mm-hmm. You and I look at the blood work and we see those elevated antibodies. We go, oh, it's no wonder you can't get out of bed. It's no wonder you can't lose weight. It's no wonder you're losing your hair. It's no wonder you're constipated. It's no wonder you're anxious and depressed and can't carry on a conversation with somebody. So it's a whole different paradigm of looking at that. So we're just about out of time, and there's so much more I want to ask you. There's so much more I want you to share with my group, because you're just a wealth of knowledge. I want to make sure that I mentioned your website that people can go to, and you've got a wealth of information there. So that's healthmysterysolved.com. That's your podcast website. And there you've got all sorts of resources to learn more about thyroid. And you've even got a thyroid class that you've put together, which I'm really excited. I think that's wonderful.
Yes. Thank you. Yeah. So the podcast has, there's over 100 episodes. Most of them are on autoimmunity, thyroid, Hashimoto's. You could just search for that. And then, yes, the course is Thyroid Mystery Solved. And it's actually going to be a personalized course for hypothyroidism, the slow thyroid, and Hashimoto's, because oftentimes, people, as we mentioned, they may have high TSH, or they may have low T3, or they may have low free numbers, or they may have another thyroid, and I call these thyroid types. And so not everyone needs the same approach, because when it comes to thyroid, as in, most health conditions, it's not a one size fits all approach. And so with that course, I walk people through figuring out what their thyroid type is, and then personalize the step-by-step process to exactly their thyroid type. So whether they have Hashimoto's or any type of hypothyroidism, whatever it may be, we support that.
So, this has been great. I think you did a really wonderful job of making it simplistic enough so that people can understand more about the thyroid and just how important the role of the thyroid is in really every function of the body. So thank you so much. And I look forward to us getting together again, and we'll have to do a whole podcast just on Hashimoto's in the future.
I would love that. Absolutely.
Great. Take care.
Take care. Bye.